You finally managed to get through to your GP surgery. But before you can speak to a doctor, you're asked a question. Can you tell me a bit about what the problem is? For many people, that moment can feel uncomfortable, even frustrating. Why do they need to know? Are they trying to block access? Are receptionists acting as gatekeepers? Today, let's take a closer look at what's really happening at the front door of modern general practice. First, it's important to say this. The last thing you want is to explain personal medical details to someone who isn't a doctor. It can feel intrusive. It can feel like a barrier. And sometimes, it may even feel as though your concerns are being judged. If you've ever felt this way, you're not alone and your feelings are valid. But there is much more to this interaction than meets the eye. Around 90% of NHS patient contacts occur in general practice. For most patients, the first person they speak to in the NHS isn't a doctor or a nurse, it's a GP receptionist. GP receptionists are often described as the front door of general practice. What many people don't realize is that receptionists are trained members of the primary care team. While they are not clinicians, they receive training in patient confidentiality, safeguarding, communication and care navigation, signposting to appropriate services, recognizing potentially urgent situations. Their role is not to prevent access to care, but to help patients reach the right professional at the right time, whether that's a GP, nurse, pharmacist, physiotherapist, mental health practitioner, or another specialist within the primary care team. They are not gatekeepers. They are care navigators. They play a vital role in ensuring that the surgery operates safely and efficiently. So why are you asked about your symptoms? There are three main reasons. 1. Clinical prioritization. Basic information helps the clinical team identify patients who may require urgent attention, such as those experiencing chest pain, breathing difficulties, or signs of a stroke. 2. Directing patients to the right professional. Not every health concern requires a GP. Many issues can be managed more quickly by other healthcare professionals within the practice, often leading to faster and more appropriate care. 3. Efficient use of limited appointments. With demand far exceeding capacity, gathering key information ensures that available GP appointments are reserved for patients who most need them, while others receive timely help through alternative pathways. Imagine starting your day at 8 a.m., with dozens, sometimes hundreds of calls arriving within minutes. Each caller may be anxious, unwell, or distressed. Receptionists must remain calm, compassionate, and efficient while managing administrative tasks, assisting patients at the front desk, and coordinating with the clinical team. They often face emotionally challenging conversations. Yet, despite these pressures, they continue to serve as a vital link between patients and healthcare professionals. Their contribution to patient care is immense and often underappreciated. Consider this scenario: a patient called in describing mild chest discomfort. The structured questions highlight potential risk factors, prompting signposts to emergency services or immediate review by the clinical team. The patient therefore receives needed urgent medical attention. In another situation, a receptionist identifies other concerning symptoms during a phone call and escalates the case immediately. One day I was about to call in my next patient when one of the receptionists came in and told me what she observed while the patient was in the waiting room. That little information greatly helped focus my attention and get the patient the necessary urgent medical attention needed. So, receptionists play a crucial role in patient management and patient safety. At this point, I have to mention an unfortunate reality at the front desk of general practice, one that is often unseen, but deeply felt. Many GP receptionists experience verbal abuse as part of their daily work. When patients are unwell, anxious, or frustrated about access to appointments, those emotions can sometimes be directed at the person answering the phone or sitting behind the reception desk. But it's important to recognize that receptionists are not responsible for the pressures within the healthcare system. Surveys from organizations such as the British Medical Association and the Royal College of General Practitioners suggest that a significant proportion of practice staff, including receptionists, have experienced verbal abuse from patients. This is not only distressing for staff but can also affect morale, staff retention, and ultimately the quality of care delivered. Let's be clear, verbal abuse is unacceptable and unfair. Receptionists come to work with the intention of helping patients. They are part of the healthcare team, striving to ensure that everyone receives the care they need as safely and efficiently as possible. Behind every phone call is a human being, someone who is doing their best in a demanding and often emotionally challenging environment. Instead of viewing receptionists as gatekeepers, it may be more helpful to see them as care navigators, professionals who guide patients to the right support at the right time. When they ask questions, it is not to deny access, but to ensure that urgent cases are prioritized and that patients are directed appropriately. A culture of respect and understanding benefits everyone: patients, staff, and the healthcare system as a whole. The next time you speak to a GP receptionist, remember that they are not a barrier to care, they are a bridge to it. Kindness and patience can transform a stressful interaction into a collaborative one. By treating each other with respect, we help create a healthcare system that is not only efficient but also compassionate. In recent years, many GP surgeries have introduced another layer of support to help manage the growing demand for appointments: AI-powered triage systems. At my own practice, for example, we use a system called Rapid Health, an AI-supported triage platform designed to improve access and streamline patient care. So, what does this mean for you? When you submit your symptoms through an online form, the system asks structured, clinically relevant questions similar to those a clinician might ask during an initial assessment. This information is then reviewed by the practice team, allowing us to prioritize urgent cases and direct patients to the most appropriate type of care. Importantly, AI triage does not replace GPs or receptionists. Instead, it supports them. For patients, it offers a convenient alternative to calling at 8 a.m., allowing requests to be submitted at any time. For receptionists, it reduces the pressure of gathering detailed information during busy periods. For clinicians, it provides structured information that helps prioritize care safely and efficiently. Every request submitted through systems like Rapid Health is reviewed by a trained member of the clinical team. The final decision about your care is always made by a human professional. Of course, these systems may feel unfamiliar at first, and not everyone is comfortable with digital tools. That's why traditional access routes such as telephone and in-person requests remain available. The goal is not to replace personal contact but to expand the ways patients can access care. Ultimately, AI triage helps ensure that the right patient receives the right care at the right time, while easing the pressure on an already stretched system. So, are receptionists blocking access to care? No, they are facilitating it. Together with clinicians and supportive technologies like AI triage, they form an essential part of a system designed to help patients receive the care they need, when they need it. The next time you speak to a receptionist or use an online triage system, remember that they are all part of the same team working to support you. This is the diary of a UK GP. If you're looking for honest, inside insight without drama, without politics, subscribe and follow the series. Because trust in healthcare doesn't rebuild through arguments. It rebuilds through understanding. Thank you for walking this journey with us. Peace.